Hi everyone, this is my first ever video on YouTube and it's going to be about cancer. More specifically, it's going to be about my experience being diagnosed with a rare form of blood cancer. So, a little information to start the video. I am 25 years old. I've had no underlying conditions, and I have some instances of cancer in my family and even one case of leukemia, but both me and my doctor believe that it is in no way connected to my condition. So what I have is commonly referred to as MPN, or myeloproliferative neoplasmosis, which is MPNs are a cluster of conditions caused by mutations in the bone marrow, and they include ET, or essential thrombocythemia, polycythemia vera, primary fibrosis, and some other ones. Mine is unclassified as of right now, so I don't have a specific diagnosis. We know my mutation, but my disease is at such an early stage that it has not yet progressed enough to see which way it's going to go. So it's not leukemia or lymphoma, it's a different thing, and it's still considered part of the cancers of the blood system. So how I found out. In October, I did a regular blood test, and it showed a very much increased level of platelet cells, which are the cells in your blood that help your blood coagulate and form clots. So my thrombocytosis is what it's called, was isolated, which means that my platelets were up while everything else was normal. I was referred to a blood institute in which I did some more tests. I also went to see other doctors like gastro, infectionist. I checked my hormones, vitamins, I checked everything. I did a bunch of ultrasounds, scans, I did a gastroscopy. I basically checked my whole body, but the Blood Institute was my place to be because 2 months after I first came in, I had my diagnosis. At first they tested me for leukemia, which I was showing no signs of that, but they had to test me. Then they tested me for a mutation called JAK2, and I was negative for that. That is the most common mutation for MPN diagnosis. And then when I was negative for that, they took a sample of my bone marrow from my left hip and looked at that, and also did another test on my blood to see if maybe I had some of the more rare mutations, and I did. My mutation is CALR, or calreticulin mutation. It's the second, I think it's the second most common amongst the MPN causes. So I don't have JAK2, I was negative for that, but I do have CALR. calreticulin. There are other mutations even more rare than that. But luckily, we found mine on our second test, because the other, even more rare ones I would have to wait longer, and it was also way more expensive because it requires like top-notch technology and rare specialists. So, December 28th, I was officially diagnosed. It was my Christmas present because at that point I was so tired and exhausted, and I honestly went there hoping that they would tell me, like, yes, we found this, it is over, now we're just gonna make a plan on how to act on it. And I am so very grateful, and I feel so lucky to have my doctor, my hematologist, which is the doctor that deals with everything blood. He's been such a positive influence and such a just a force. I know that for a lot of people, being diagnosed in just 2 months is crazy, especially with different cancer types and all that. I know that people wait for their diagnosis for 6 months, a year, 2 years. Mine was luckily very quick, and thanks to my doctor for that. So, I will go into his opinion and prognosis for it, and then a bit later I will talk about symptoms and what to look for. So my doctor thinks that the prognosis is very good because we caught it at such an early stage, and it's also not a very aggressive mutation. He said, for example, that if I was positive for JAK2, that it's way more aggressive and it progresses way quicker than calreticulin mutation. But there's not a lot of research on that because calreticulin was just recently discovered, so there's not a lot of data around it, but that's his opinion. He gave me 15 to 20 years of normal life, and then he thinks that once I'm closer to my 50s, my disease will probably progress enough to either start serious treatment or think about getting a transplant of stem cells or bone marrow, which is the only way to cure this type of blood cancer. So there's no chemo, there's no immunotherapy, no radiation, no targeted therapy. The therapy that I receive now is one pill of aspirin every day for the foreseeable future, maybe for the rest of my life. And the only reason for that is just to prevent me from getting clots in my blood, because again, when you have so many platelet cells, and I currently have, again, double the normal amount, you're much more prone to forming clots that can cause a heart attack, that can cause stroke, and a bunch of other very bad things to happen to you. So I'm preventing that by taking aspirin that liquefies my blood. And I'm also supposed to do a full blood test every 3 months and see my doctor every 3 months. Once a year, I'm supposed to do a gastroscopy to check my stomach, because aspirin can damage your stomach. And I also have to keep an eye on my liver and my spleen. Your spleen is where your platelet cells break down. So your spleen and your liver break down your blood, but platelets specifically break down in the spleen. At least that's what my primary physician told me. Because at first, when she saw my very first bad blood test, she asked me if I still had my spleen, because she thought, like, wow, you have so many platelet cells, maybe they just don't break down, so you must not have your spleen. But I do, and I have to do an ultrasound of it once a year. And also, in a few years, my doctor wants me to repeat the biopsy, which I'm fine with doing blood tests and ultrasounds and even a gastroscopy, but the biopsy was traumatizing. It was fun, thanks to the doctor and the nurse that did it, but it's so bad. Some people tried to tell me that, oh, it's not gonna hurt that much, but maybe they had their biopsy from like a tumor or skin or somewhere, but the hip bone biopsy, that is, they're breaking and drilling into your bone, and you're conscious for all of it. And the anesthetic only affects the soft tissue, so you feel everything in your bone. So I'm not looking forward to doing another biopsy, but luckily I'll have to do it in maybe a year and a half, 2 years from now. So that's the prognosis and treatment. Also, talking about prognosis, I am at a low risk of complications or rapid growth of the disease. But the thing is, it is very unpredictable and it can never progress. It can progress in 20 years from now, or it can just be triggered by something and progress to a full blast crisis tomorrow, and I'll just die. So, symptoms: discomfort in the spleen area. Sometimes in the liver. I know people get discomfort in their liver. I don't experience that, but I do get discomfort in my spleen. Sometimes it feels like someone's poking on it, but I wouldn't say that it causes any issues for me. I just acknowledge it and move on. It is also slightly enlarged. I have like the first stage of splenomegaly, I think it's called. Basically, when you have an enlarged spleen. Another symptom that I found in some article on my disease, it's bone pain. But I have to say this, my doctor does not think that it's in any way connected. This is just me. I think it's connected because a couple of years ago, I started experiencing a very specific type of bone pain, which I had never experienced before. And it is also something that I've never heard anyone else talking about. It is a very specific feeling, and I can only describe it as, and this is gonna sound crazy, as my bones being sick, like car sick. Like, you know, when you're about to, that sickness, if I feel it in my bones, like inside them. My upper back also feels very stiff, but that could be just due to not having active enough lifestyle. But that sickness in the bones, especially in the elbows, and like the general shoulder area, can appear absolutely randomly. At first I thought, way back like 2-3 years ago, I thought, oh, maybe like my mattress is bad, or maybe I slept weird. But then I noticed that it doesn't affect, like, my bed or my sleeping position doesn't affect it at all. The only thing that can affect it is when I sleep with my arms bent. And I think that because my blood is so thick, it just sort of stays in my arms throughout the night, and maybe my arms hurt because they don't get enough blood flow. Maybe it's that, but also the bones themselves hurt. Another symptom is headaches. No idea if my headaches are caused by my condition or just my lifestyle, because I'm a mad person. I sleep during the day and I stay awake at night. I'm malnourished. I have great vitamin D deficiency, so I cannot say anything about headaches being a symptom of this specific disease. Another symptom is night sweats. I don't get them. I've had them for like a month, but they were definitely a side effect of my antidepressants. But that, it sucks. Night sweats are awful. Another symptom listed was itchiness of the skin, but again, I don't have that. For me, the symptoms were bone pain, very quick blood coagulation, like whenever I would get a cut or a scratch, the blood would immediately stop, like, because I have so many platelets and they are the cells that stop your blood. They act like glue. So that was a symptom. I would also rarely get bruises, and my bruises would go away pretty quickly. Yes, I think those are all of my symptoms, but it is completely unreasonable to think that you have blood cancer if you experience some bone pain, or if your wounds heal quickly. Maybe you just have a great immune system, or I don't know. But please go and get your blood tested at least once a year, because that's the thing that helped me catch my disease at such an early stage that it's not even a classified disease yet. So that was my experience of finding out, being diagnosed, and I'm making this video because when I was going through it, I needed a video like this. This is such a rare condition that there's not a lot of articles or videos on it. There is a YouTube channel called Voices of MPN, but they are very much, they feel to me like more of a documentary channel, and they mostly focus on the older people, because this disease is commonly found in older people. This is why I joke that I hit the jackpot 3 times. I got cancer. I have cancer that is predominantly found in older people and also in men. So it's rare in itself, and it's also found in older people and mostly in men. So yes, Voices of MPN mostly focuses on like the scientific part of it, and also on older people, and just in general, I didn't really connect or relate to their channel. I just wanted someone to talk about it, just like I'm talking right now, and talk about their experience, their fears, the process, everything like that. I'm not scared anymore. I am working towards completely accepting this as just another part of me, and I am planning on living with it for the rest of my life. Not like I can do something, but I'm planning on living a good and long life with it. And I probably will make another couple of videos focusing more on the experience with the medical field and different doctors, how I felt, how they felt about me, and another one on the more emotional side, how I cope with it, what helped me, what advice I was given, because I did go to a psychiatrist. I started taking antidepressants, and I also had a cycle of therapy with a specialist in oncopsychology, so a person that works specifically with cancer patients and their loved ones. I did that, and just in general, what helped me, how it went with my friends, my family. I will make another video on that. And I would also like to make a video on how it all affected sort of my perspective on life and death and fate and all of the philosophical stuff. So, thank you to whoever stayed and watched this video to the end, and I'm very grateful. And I wish everyone a healthy, good life, and I advise everyone to just get checked from time to time and also approach your life with a little more humor and be lighthearted about your issues, because that's what helps me the most. And till next time, bye!